Do you frequently feel like your skin is more painful than it should be after a small cut or bug bite? Imagine scraping your knee while playing soccer, and instead of getting better in a few days, the area becomes extremely painful, red, and swollen, much worse than any normal injury you've had before. That's a red flag. This might not just be an infection. It could be something rare but very dangerous called necrotizing fasciitis. People often call it the flesh-eating disease. Sounds scary, right? But the good news is, if you know about it early, you can act fast. It's rare, but it spreads quickly under the skin, destroying tissue, muscles, and fat. That's why understanding it matters, not to scare you, but to help you recognize it early and save lives. Ever shared a towel with someone who had a skin infection? That could be a risk if the right bacteria enter your body. Necrotizing fasciitis is mainly caused by bacteria. The most common one is group A streptococcus, the same bug that gives you strep throat. But unlike a sore throat, this bacteria can sneak into your body through cuts, scrapes, burns, insect bites, or even surgery wounds. Think of it like a burglar. A tiny opening in your skin is all it needs. Once inside, it multiplies fast and releases toxins that kill the tissue they touch. Other bacteria like Staphylococcus, Klebsiella, or even those found in seawater like Vibrio vulnificus can cause it too. You're at higher risk if your immune system is weak. For example, if you have diabetes, cancer, or drink heavily. But even healthy people can get it, which is why you should never ignore a wound that's getting worse rapidly. Have you ever had a fever and muscle pain, but didn't think much of it because you thought it was just the flu? Now imagine that pain is coming from a small, red area on your arm, but it feels like a burn or deep pressure, even though the injury looks small. That's a classic clue. The symptoms of necrotizing fasciitis start mild, but escalate fast within hours. First, you might feel intense pain, way more than the size of the wound would suggest. Then the skin turns red, purple, or even black, as tissue dies. It may swell, feel warm, and later develop blisters or a crackling feeling, caused by gas from bacteria under the skin. You might also get fever, chills, nausea, or feel very weak, like your body is shutting down. Imagine a teenager who got a small cut while swimming and 24 hours later is in the ER with a leg turning black. That's how fast it moves. So ask yourself, is this just a bad infection, or could it be something life-threatening? Let's say you go to the doctor with severe pain and swelling after a minor injury. What happens next? The doctor won't wait, time is tissue. They'll examine you closely and check your medical history. But since early symptoms look like regular infections, they might run blood tests. High white blood cells and other signs of shock point to something serious. Imaging tests like MRI or CT scans can reveal damage under the skin. The best way to confirm it, though, is surgically. A doctor may make a small cut to look at the tissue. If it's dead or looks dishwater-like, they'll act immediately. Treatment starts fast, strong IV antibiotics to fight bacteria, and emergency surgery to remove dead tissue, sometimes more than once. In severe cases, amputation is needed to stop the spread. You'd also get fluids, medicines for blood pressure, and maybe a ventilator if you're very sick. Think of it like fighting a fire. Antibiotics cool it down, but surgery cuts off the fuel. Without both, the fire can kill you in days. Can washing your hands really save a limb? Yes, and more. While necrotizing fasciitis is rare, prevention is simple and powerful. Always clean cuts, scrapes, or wounds with soap and water. Use antiseptic and cover them with a bandage. If you're diabetic or have poor blood flow, check your feet daily for sores. Don't swim in lakes or oceans with open wounds, especially warm saltwater, where Vibrio bacteria live. If you have surgery, follow wound care instructions exactly. And here's a practical tip. Teach kids to tell an adult if a scrape starts to hurt way more than it used to. Remember, early care prevents disasters. Just like wearing a seatbelt doesn't mean you'll crash, but it saves you if you do, wound care doesn't make you immune, but it reduces big risks dramatically. What if doctors could detect this disease in minutes, not hours? Recent research is moving fast. Scientists are testing rapid genetic tests that can identify the exact bacteria from a tissue sample in under an hour. Others are studying new antibiotics that target toxin-producing bacteria more precisely. Some hospitals now use scoring systems, like the LRINEC score, to quickly decide if a patient might have necrotizing fasciitis based on blood results. There's also research into hyperbaric oxygen therapy, where patients breathe pure oxygen in a pressurized chamber to help healthy tissue survive. And get this, wearable sensors are being developed to monitor wounds for early signs of dangerous infections. Imagine a smart bandage that alerts your phone when a cut starts getting too hot or inflamed. These advances could mean fewer amputations and more lives saved. The future isn't here yet, but it's coming, and awareness is the first step.